I don't see the hospitals and doctors represented on the panel this evening, and I heard mention of healthcare system reform. What reforms will be expected by these two entities? Anybody? Barry?
Well, I think that you may hear a term that's going to be thrown around and discussed at great levels with quality-based reimbursements. And what you're going to try to see is getting away for what they call the fee-for-service system, where everybody, whether it's a physician or hospital, is reimbursed based on how many procedures they perform, how many tests they run, how long somebody is in the hospital, regardless of whether they get better or whether they actually get sick or whether they're really going to try to implement some quality measures associated with that. So you're going to reward people that are effective and efficient in how they care for people, not so much for how many tests they perform or how long they're providing services.
Just a quick observation. The State Medical Association was allowed to participate and they chose not to. And I do appreciate Louise, Reese, the Primary Care Association representing providers on this panel.
How can insurance companies afford to cover persons who have pre-existing conditions? It does not seem reasonable to issue policies with immediate potential losses.
Well, the simpler answer to that is by getting everybody in the system having some level of coverage that is appropriate for them. It allows you to spread that risk to those people that may be coming into the system immediately with established pre-existing conditions and costs associated with that, so that you're able to spread that cost over as many people as possible. Everybody is absorbing a little bit of that cost and therefore making it more affordable for everybody. Not having everybody in the system, and that is a recipe for disaster.
To what extent do any of the bills contain costs for medication?
The House version of the bill allows the Secretary of Health and Human Services to negotiate directly with pharmaceutical companies for lower Part B medications. The Senate bill does not allow that.
But we do have the opportunity for compromise there,
yes, we do.
which AARP would support, obviously, the price negotiation as well as the safe legal importation of lower priced drugs from countries abroad. And also the sale of generic versions of biologic drugs, which are costly medications that now treat diseases like cancer and multiple sclerosis.
What in the bills helps the underinsured, i.e. $2,000 to $5,000 deductible, no coverage for preventive care, and no help for RX, prescription drugs?
The models on both the House and the Senate, as they currently exist, would provide for the products we offer through the exchange to have a minimum value, and those would require a certain level of benefits to be offered through those they're looking at. And this is similar to what's been done up in the state of Massachusetts already, where bronze, silver, gold, and platinum option plans, all with different values based on the level of benefits, and products available through the exchange would have to meet those standards. There is some concern, quite frankly, on some of the products that people buy now at their own choice, where they prefer to have more of the risk on themselves. There is some provision in some of the plans and some of the bills to allow for grandfathering of those people that have those existing plans. They can keep those, and we support that option. But those that would go through the exchange would have minimum standards available to them. There's a balance there, obviously, for the cost of those plans relative to the value of those benefits, and I think you'll hear some additional discussion today about those items going forward the next couple of months.
But they all do require prescription drug coverage.
Yeah, I'm not aware of anything that would require some prescription drug benefit.
We're going to go through maybe one or two more questions on the cards, but the next part of the segment for this evening is allow you to make some comments. So if you would like to make a comment, please line up at one of the two microphones that are off to my right and left. I was born and raised in West Virginia and have lived in Europe and Canada, 30 years in Canada. I can tell you that the medical system there works, and what a great thing to be able to walk into a clinic and see a doctor and not worry about money. To Perry, when I mentioned about controlling costs, you only mentioned public insurance as an alternative. What about trial lawsuits? Is that right? Reductions? I don't get whoever asked that question, if you... Tort reform? Okay, tort reform.
We have a serious problem in this country with medical errors. The estimates are that somewhere between 45 and 98,000 Americans die each year from medical errors. I think I'm not opposed to looking at alternative dispute resolutions, but I think first and foremost we should concentrate on making sure that there are fewer medical errors in our hospitals, and that would be my highest priority. To the extent that we could develop an alternative, I'm struck by the National Safety Transportation Board. They investigate every airplane accident that occurs. They've done a remarkable job, and they refuse to accept the pilot error as a result of this. They demand that a systems change be put in so that another airplane won't suffer the same fate. And I think we need to develop the same kind of strategy to deal with medical errors in our hospitals. Make sure that we don't just say, well, it was a bad doctor. That we put in place system changes to make sure that nobody goes through the kind of errors that some people set up.
Thank you, Steve. Anything that you'd like to add?
I think comprehensive legal reform would be a good addition to any of the legislation being considered. Nor I don't think that either of those, what area on or comprehensive legal reform, would be mutually exclusive. I think we have seen that legal reforms do work. We have a lab that was called West Virginia. We have the gold standard of medical malpractice reform. As a result of reforms that have passed in West Virginia, we have more doctors, more specialists, more availability of medical malpractice insurance at lower rates. So we know it works. I think, however, the idea that Perry outlined, which is that we establish a real quality process to help deal with medical errors makes lots of sense, and I don't see the two as being mutually exclusive at all.
Thank you, Steve. Anybody else?
Just in defense of the hospitals, all the hospitals in West Virginia do have a quality improvement program, and all of them work very hard to implement programs that would continually make process and systems improvement. Obviously, we can all share a story, a personal story where somebody did not receive the care that we expect. But performance improvement, it is a continual event. It's not something that today is wrong and tomorrow is perfect. And so I would stress that they are all working to make those improvements continuous.
Right.
Just one quick comment. I know just using Congressional Budget Office numbers, I think it's about when this should be explored. They estimate that over 10 years it will save $54 billion. So obviously that's a lot of money to be considered to left on the table without further discussion.
And I'm going to keep going through the questions because I don't see anything on the microphones. I'm sorry, go right ahead.
There was a question about how private insurance companies could afford to take in people with pre-existing conditions. I'm wondering how they can pay their CEOs like Cigna $25 million, or Coventry $14 million, or Humana $10 million, or Aetna $24 million, or Blue Cross, a non-for-profit organization. Massachusetts gave their chairman $16 million in retirement, and CEO got $19 million in salary and benefits. That seems a little out of line for an industry that is there to provide me health care. After 35 years of teaching, the one gentleman here, Bill McGuire, will make in 1 year 200 times what I've made in a lifetime in 1 year. So private insurance companies aren't hurting, I don't believe, by what I've read. And I can't imagine any other term other than greed for this sort of dollar and cents figure. I don't know what else to do.